question number 1. What will it take to get the 10-day standard duration for many antibiotic therapies shifted?
Brian, I imagine you got that one figured out.
Yeah, all of them. No, I think that's changing. What we've seen recently, if anybody's gotten a prescription recently, the motto of take the entire course of antibiotics is starting to shift back to take the antibiotics as directed by your physician, and some of that is coming to. We've been there in the past and we stepped away from it, but it's take antibiotics until you feel better. And so I think we're in the midst of really the first step is to challenge, is this duration appropriate? So we're asking the questions, is that really enough? Is it too much? We've got some philosophical shifts among the prescribers, and then the last piece is just the data that says, hey, we've done some clinical trials and shown that 3 days is just as effective as 10, and then prescribers have the confidence that, yeah, 3 days is enough and I can move forward.
Neville, next.
Okay. Next question. What role will genomics and or gene editing play in the future advancements of antibiotic resistance? And second part of that question, will a consumer accept those advancements?
Which one of you guys want to handle that one?
Is this on? Hello? Yeah, I think they're going to play a significant role, especially when we start to look at the alternatives and the kinds of things that I listed there. I remember that there was a slide that was presented by somebody that talked about consumer or a producer had written in a comment that they were using oil of oregano to treat their chickens the other day. I remember that being up on there. And it struck me that there are members of the industry, particularly the turkey industry, that are using high levels of oil of oregano in the turkey feed right now to control coccidiosis, because they're trying to avoid using antibiotics or other treatment modalities to control that disease. So that's not so far out there. What concerns me is that as we listened to Eric the other day, and when he brought the box up and showed the bottles of medicine that his, I think, great-grandfather used as a veterinarian after he got his degree from the University of Chicago in the 1800s, we don't want to return back to the days where snake oil was being peddled. And so here we have these very effective tools that have been proven to work, and they're being taken away from us, and we're substituting things that we don't know much about. And we need regulation and we need understanding about how those things work. And to me, that's every bit, if not more dangerous than when science proves to us that messaging or metabolites or peptides or gene editing for vaccines or other things work. We ought to be able to use those things and accept them as proven modalities of treatment. The other things, I think, are tough.
I can add a comment on the consumer side. Just to add a comment there, I think one of the things that we learned in the last few years is that we have to be careful how we start framing that since the very beginning. Any new technology that we have, we need to do a good job, starting even the naming process, the way we talk about it, the way we describe it in a way that resonates with consumers and it doesn't create more fear. It's a lesson that we learned, I think, with some technology that we have today.
That's a good point.
Katie, you've got a question in the back there.
Dr. Granger, your last comment about the oregano oil, and there's a whole other class of, as I've made the statement several times, I don't like the term alternative to antibiotic. They're really ways of reducing the likelihood that you're going to need to use an antibiotic. But part of the challenge around things like oregano and others, essential oils, is that we in the allied industry have to skirt around what we do, because if we start talking about this works against that in this way, the fear is that it's going to start to be considered an antibiotic or a drug and fall under FDA guidance rather than just be considered what it is as a feed additive. How does that get addressed? Obviously, you're with the USDA that's separate from FDA, but how do we make that gap between things that work that are not antibiotics but avoid them from getting put under FDA guidance?
Yeah. And you said it better than I did, because that was exactly my point. You know, when we talk about pure, safe, potent, and effective, those are the guidelines for how we approve animal drugs now, or vaccines in the Center for Veterinary Biologicals. They have to meet all of those criteria. And I think that to put that challenge maybe a little bit different way, how do we get antibiotics labeled for uses that we know they're effective for? Just the tools that we have. We can't even do that. We can't suggest to a drug company that an antibiotic that's on the market should be reevaluated to be used a different way, and that the drug company ought to make that investment to get that label change made, because they're going to look at you and go, that costs millions of dollars and it's not worth it to us. So how do we do that? Well, one way would be to gather the data from the field, from those people that are using these things, and to do that in a controlled experimental way that's scientifically acceptable, to make that data available and then make the case, whether it's the drug company that pays for it or the producer that's trying something new, or the veterinary clinic that has devised a way to collect data that makes sense. Doesn't really matter, does it? We have to be able to make that case in a way that allows the regulatory system to adapt and become flexible enough so that those things can happen, I think. So.
Thank you, audience. I think we're run up against our time. Please give these panel members your applause.